Hi, today we're talking about Endolift. Endolift is a very new treatment for us. It's something we've just started offering at Élan Aesthetics, and I'll give you a bit more information about it. Endolift is an energy-based treatment, and more specifically, it's a laser, and this laser is carried in a little optic fiber that is twice the thickness of a human hair. And the fiber is inserted in the subdermal layer of the skin. And in the subdermal layer, you find a lot of collagen fibers. And when it travels in that subdermal layer, it delivers energy in a pulse, and that causes those collagen fibers to contract. It also causes elastin fibers to contract, and it also removes or breaks up fat cells. That's the short-term function of the Endolift laser. The long-term function, and the part that we are also very excited about, is it causes a response from the body, or specifically the fibroblasts, the cells that form the collagen fibers and elastin fibers, to produce more collagen. And collagen fibers specifically. When you get older, you lose collagen. The collagen fibers are not as nicely aligned as they used to be. They lose their elasticity, they stretch out, they break. Your fibroblasts loses the ability to produce as much collagen as it used to. A lot of our anti-aging treatments are focused on helping the body to stimulate or to reproduce more collagen. So this is where Endolift really exceeds, and then the fact that it removes fat as well. That's just a couple of words about how the Endolift laser work and where it is used. So what kind of areas can we treat with this Endolift procedure? Typically areas where the skin has lost its elasticity and it's become lax, or you start to see a crepiness in the skin, you start to see fine lines and wrinkles due to the loss of that collagen. So typically in the face, we tend to see that in the under eye areas. We tend to see that around the mouth, vertical or smoker's lines and upper lips. We start to see those due to a loss of volume. We start to see the marionette lines. And as the skin becomes lax, you start to see a jowl formation and a double chin. That might be a combination of a little bit of fat and skin laxity in that area, and you start to see a diminishing of a well-defined sort of jaw. We also start to see necklace lines in the neck, horizontal lines that starts to develop in the neck. So those are all areas that the Endolift are very good at treating and really excels at. There is some other areas on the body that you can also treat. The underarm areas are quite popular, inside of the thighs, the upper part of the knees. So loads of other areas, quite popular with mums that had babies. And now after the pregnancy, there's a little bit of laxity around the navel. They start to see a bit of wrinkling around their tummies there, and they want to retighten that skin. So very good for tightening skin and reducing laxity in the skin and reducing fat pockets in areas. So very good for that. Very excited about that as well. That's what Endolift treat is for. You can combine it with other treatments. So you can do it in conjunction with Profilo. You can do it in conjunction with skin boosters, dermal fillers, and botulinum toxin. So anti-wrinkle treatment works very well in combination with other treatments. And typically after we've started stimulating the collagen or the fibroblasts, we want to give them the necessary building blocks to do that in the way of hyaluronic acid. Is this a painful procedure? No, it's not a painful procedure. There's a low level of discomfort. We make it as comfortable as possible by giving a local anesthetic in the areas that we are going to be delivering the treatment. A little bit of local anesthetic, and then the treatment is very comfortable. It only takes about an hour, and the patients very rarely complain of any discomfort during the treatment. Is there any contraindications? If the patient is an anticoagulants, or they take aspirin or non-steroid anti-inflammatories, we have to be a bit more cautious. But there might be a higher risk of bleeding or bruising, but typically there's no real contraindications. We can do it on most patients. And another question that we get is, will I be out of action, or will I lastly different or swollen afterwards? And the answer is no. We Endolift, we might get a little bit of redness of the skin directly after the procedure. There might be a little bit of swelling. We sometimes see a bit of bruising if we do the under eye area, because the skin there is quite thin. So might see a little bit of bruising there, but mostly there's very little downtime with this procedure, a little bit of discomfort, maybe a little bit of swelling, not really that noticeable, and it will last maximum a week if there's any sort of long-lasting side effects, after effects. So a very good procedure in that sense. It sometimes is referred to as the lunchtime facelift. It is very non-invasive, and a lot of the patients literally go back to work after they had the procedure done, or they carry on with their lives as normal. How long does Endolift last? So we typically see a very quick, immediate result of skin tightening. The patients always comment on how nice and tight the skin feels after the treatment. So we see immediate tightening effect where the laser delivered the energy to the collagen fibers and tighten the skin. And then we see a prolonged result that reaches its maximum between 3 to 9 months. And then a very nice, long-lasting result. Patients can book for virtual consultations over Zoom, or they can come and see us in person. And we are very much in that phase where we are building portfolio. So we are happy to speak to anybody about any kind of problem areas they have or they want to address. Thank you very much for your time. Please contact us on elanesthetics.com to make any bookings, or for more information, visit us on Facebook.